Hey everybody, what's going on? It's Jason Wisniewski from JW Senior Insurance coming back at you with another video today. And today's topic is going to be what to look for in dental coverage when it comes to Medicare Advantage plans, and also what to look for from your dentist before they start your treatment plan. So we're going to talk about both of those things. First of all, you want to get into when you're about to do dental work, you always want to have uh, a pre-treatment estimate of what the dentist actually wants to do. So that's going to help you better prepare in terms of what you're going to need for coverage and what you could potentially be facing out of pocket. So what we're looking for are D codes that dentists use for certain procedures. Like for example, there's a D code for partial dentures, for a tooth extraction, for cleanings, X-rays, exams. Various dental procedures all have what's known as D codes. And when you're looking at an insurance plan, you want to make sure that the D code is on that plan's list of covered services. So, um, and also the nice thing about when you're getting dental from a Medicare Advantage plan is there are no waiting periods. Unlike when you buy dental insurance on the individual commercial market, a lot of the times there's going to be a waiting period before certain services are covered. Since the Medicare Advantage plans, dental is tied in with the health plan, they don't have waiting periods on that. So your coverage will start immediately. It's just going to be a question of is that particular service covered on your particular plan? And if you're a client of ours, of course, we're going to help you out with that. We're going to make sure that the procedure that you're considering is covered by your insurance plan, um, before we do an enrollment for you on that. Of course, with any Medicare Advantage or Medicare health coverage, we're always going to look at other factors, besides dental, but it is a big part of the plan for many people. A lot of people come to us with dental concerns because, let's face it, dental work is quite expensive, and you do need significant insurance for a lot of procedures. Especially people that are coming to us, they may need teeth extracted and, getting a set of dentures, replacing, existing partials or full mouth dentures, can be costly, and we're going to need insurance to cover that. So, some things to pay attention to obviously are going to be the annual allowance allowed by your dental plan. So that's the annual amount of coverage that you have for that particular plan year. Now, that's not the end all be all. I'll give you an example. You can have a dental plan with, let's say, a $20,000 annual allowance versus a plan that may have a $2,500 annual allowance. Now, on the surface, the one with $20,000 of coverage may appear on the surface to be better, you would think. But that's not always the case because you can have a high allowance plan that has fixed copays for certain services. So you can maybe tooth extractions have no copay, and that's great. If you're getting, 10 or 13 teeth pulled, obviously you need a really high allowance, at $200 an extraction, that's a couple $1,000, if you've got 10 teeth coming out. Um, so a nice high allowance is good. But what if it has a fixed copay for dentures? Maybe it's $500 or $600, for an upper, and another 500 or 600 for a lower. Then that's, you know, there's some out of pocket there. Now, you may have a plan. Um, let's say that uh, you don't need, maybe you only need one or two extractions, okay? And so that's figure at 200 an extraction, so $400. And then if you're on a, let's say you're on a $20,000 plan, but then you have, $600 copay per, you know, for an upper and a lower, then that's $1,200 out of pocket. Now, if you have a $2,500 plan with no copays, you get the two extractions. Okay, that ate up $400. Now you've got 2,100 for the exam, X-ray, and uh, putting the dentures in. Maybe you're out of pocket only about $100 at that point. So a lot of things that we look at, not only from an allowance standpoint, but does the plan have a fixed copay for certain services, or is it just a straight allowance with no copays up to that allowance amount? You know, so there's different factors that we look at. Of course, if you're one of our clients, we're going to do all that for you, before you sign up. But those are some of the things that you want to look at when you're comparing the dental benefits of various Medicare Advantage plans that you're shopping. So, that's basically, in a nutshell, allowances, are there copay amounts, and, obviously, does it have the covered codes that you're looking for? Um, you know, Not a whole lot of plans out there covering implants. There are a few here and there, but that's a little bit more on the rare side. Most plans that offer comprehensive dental coverage will offer coverage for traditional dentures. So that's not too hard to get. If you need alveoplasty, that varies by plan. That's when you need to have they need to kind of give you some more support for your gums if they can't hold dentures, if your gums have been sunken in. We're going to compare carriers for you there and make sure that that is a covered service should you need that. And that's why that pre-treatment um, plan is so important, to know what exactly needs to be done before you go and get the insurance that you want to cover these services. So very important there. And then also, we're going to look at the dental network. Obviously, is this a PPO? Is it an HMO? Do you have access to the dentist that you want to see? So, we'll always take a look at that. If you don't have a dentist, certainly, we can recommend them, based on our own experiences with, sending clients there, or, various, star ratings on Google or other sources, health plan sources that we can find to see how these offices are rated. Because member experience is always a big thing there as well when we look at these plans. So if you do need our services, of course, if you're in the Burlington County, New Jersey area, we staff the Burlington Walmart Monday through Friday, 10 a.m. to 5 p.m. So you can always stop in there. We'll be there at least through March 31st, possibly past that. We'll see. We're always there during the Medicare annual enrollment, October through December, and also through the Medicare Advantage open enrollment, January through the end of March. Um, so otherwise, you can get in touch with us. If you're not in that area, you can always give us a call at 609 496 8030, or visit us on the web at www.jwseniorinsurance.com. And thank you guys for tuning in, and we'll see you guys on the next one. Take care.